Okay, so we'll start with the arterial anastomosis around the shoulder joint. Remember that the shoulder joint contains majorly your deltoid muscle. Now, this shoulder joint is supplied by blood from different blood vessels. So we have what we call anastomosis, a group of blood vessels joined together to supply the shoulder joint. And that anastomosis is formed by branches of subclavian artery and branches of axillary artery. Remember, we said that subclavian artery becomes axillary artery, but the subclavian artery gives off some branches before it becomes axillary artery. And then axillary artery gives off some branches also. Now, there are 5 main blood vessels that form anastomosis, arterial anastomosis around the shoulder joints. We have 2 from the subclavian artery and 3 from the axillary artery. So the 2 blood vessels from the subclavian artery are the suprascapular artery and the transverse cervical artery. Suprascapular artery, transverse cervical artery. So these 2 arteries are branches of the subclavian artery. They join the subscapular artery from the axillary artery, anterior circumflex humeral artery, and posterior circumflex humeral artery from the third. These 3 blood vessels we say come from the third part of the axillary artery. So they both join suprascapular and transverse cervical artery to form the anastomosis around the shoulder joint. So this picture is showing you the shoulder joint. So here you have your shoulder joint. And this blood vessel here is called the suprascapular artery. Suprascapular artery, which is a branch of the subclavian artery. So this suprascapular artery is part of the blood vessels that form the anastomosis around the shoulder joint. And then also, you see that this suprascapular artery gives off a branch, which is called the infraspinous branch of suprascapular artery. Infraspinous branch of suprascapular artery. So this one is part of the anastomosis because it's coming from the suprascapular artery. Then we have here, you will see the posterior circumflex humeral artery. Posterior circumflex humeral artery going in a circular form. Now, this diagram could not capture the anterior circumflex humeral artery because this is like a posterior view of the scapula. So the anterior circumflex humeral artery will be in front of this one on the other side. So that is part of the anastomosis also. Then let's see, it also could not capture the subscapular artery, but know that the subscapular artery is part of this anastomosis. But because we're looking at the posterior view of the scapula, we are not able to see it, but there are 5 blood vessels. So posterior circumflex humeral artery, anterior circumflex humeral artery on the other side, subscapular artery, and then the suprascapular artery and the transverse cervical artery, which also could not be captured in this diagram. So if we look at the anterior view of the scapula, we'll be able to identify the other blood vessels. Okay, so we already talked about the axillary artery, so there would be no need to talk about it anymore. Okay, here we can see the transverse cervical artery from this diagram. So this is the transverse cervical artery, which is from the subclavian artery, transverse cervical artery. So it's supposed to come down and join this anastomosis. So here you see your suprascapular artery also coming to join this anastomosis here. And then your posterior circumflex humeral artery joins this anastomosis, and then your subscapular artery too. You see, it gives a branch going this way, forms part of that anastomosis. Okay, so we already looked at the axillary artery, so we don't focus on it anymore. Now we would move to the brachial artery. We'll look at the brachial artery. So the brachial artery is a continuation of the axillary artery just after it crosses the teres major tendon. So the brachial artery begins at the distal border of the tendon of teres major, and then it ends about 1 cm distal to the elbow joints by dividing into radial and ulnar arteries. So the brachial artery will divide 1 cm distal to the elbow joint into radial.
Cubital fossa.
Yeah, at the cubital fossa, great. At the cubital fossa. So to divide into the radial and the ulnar artery. So it has some branches. The first branch is the deep artery of the brachium, or what we call the Profunda brachial artery. And then it also gives off a nutrient artery to the humerus. And then we'll have the superior ulnar collateral artery, the inferior ulnar collateral artery, and then gives off some muscular branches. Later, you will find that there is an anastomosis at the elbow joints, and this superior ulnar collateral artery and inferior ulnar collateral artery are part of that anastomosis when we look at the anastomosis of the elbow joint in the future. So the main branches of the brachial artery: profunda brachii, nutrient artery, superior ulnar, inferior ulnar, and then muscular branches. So here in this diagram, this is a brachial artery after crossing the lower border of the teres major. So here you see the teres major muscle is here. Immediately it crosses this place, it becomes the brachial artery. And then this brachial artery gives off this deep branch, which is running posteriorly, which is called the profunda brachii artery. So it runs posteriorly. And then the brachial artery continues until it gets to before the cubital fossa. It will give off the superior ulnar collateral artery, and then we'll have the inferior ulnar collateral artery. Let's see if the nutrient artery is labeled here. Okay, so the nutrient artery is not labeled here. Okay, so but here we can see the profunda brachii, superior ulnar collateral, inferior ulnar collateral. So we can see these ones, and yeah, basically. Then here you see the anterior radial collateral, but we cannot see the nutrient artery and the muscular branches in this diagram. Okay, so that's a brachial artery. Then it will end as the ulnar and the radial artery distal to the cubital fossa. So here you see that the brachial artery, as soon as it enters the cubital fossa a little bit lower, it splits to form radial and ulnar arteries. So this is simply showing you the course of the brachial artery, how it runs alongside the nerves, the median. This is the median nerve running down along with the artery. And then there is also what we call the medial antebrachial cutaneous nerve running also with the brachial artery. And then We have the ulnar nerve also running alongside the brachial artery above, proximal to the cubital fossa. And this brachial artery is not that deep, so the course is superficial. The course is superficial. It is the profunda brachii that runs deep. This is the profunda brachii here that runs deep, but the brachial artery itself is running superficially. Okay. Then here it shows you how it enters the cubital fossa, and then later it splits into the ulnar and the radial artery where it terminates. So the course of the brachial artery. So the course of the brachial artery is superficial throughout. Superficial meaning that it did not run deep within the muscles. Okay, so it's running above the muscles, so it is superficial. Now, anteriorly, you see the medial cutaneous nerve of the forearm. You see the median nerve, the bicipital aponeurosis, and the median cubital vein. So here, I already mentioned the medial brachial cutaneous nerve. So you see the medial brachial cutaneous nerve also running alongside this artery and anteriorly. Let's see if we can find. Okay, we saw our median nerve running also, but we cannot find median cubital vein and the bicipital aponeurosis. Let's see if, okay, so here you see the bicipital aponeurosis here. So these are the tendons of the biceps muscles come down here to form the bicipital aponeurosis. So it's anterior. So you see that the brachial artery is passing below this aponeurosis. So it is anterior to the brachial artery. Then once it crosses this aponeurosis, it comes down and then splits into the ulnar and the radial artery. Then posteriorly, we'll have the triceps. So just posterior to the brachial artery, you have your triceps muscles, you have the radial nerve and the profunda brachii artery, and then the Coraco brachialis muscle and the brachialis. So these muscles, brachialis, Coraco brachialis, triceps are all posterior muscles. So they are the brachial artery is anterior to them, or they are posterior to the artery, also with the radial nerve. So you will not be able to see them here because they are under this vessel. So this, you see this muscle here that will run under the artery. This is called the Coraco brachialis muscle, Coraco brachialis muscle. So it is posterior to the brachial artery. Then if we were able to see the posterior aspect of this arm, if we're able to see the posterior aspect, you see the triceps muscle fully, but although you can see some part of it here. So this is the long head of the triceps, and this is the medial head of the triceps, but they are posterior because the bulk of the triceps muscle is actually behind this artery. So they are the posterior relations of this artery. And then your radial nerve also will run posterior, so to be below this, behind this artery, so that you will not be able to see it. That is why it is posterior to the brachial artery. Okay, let's see. Profunda brachii we already identified before. So here you see there is an artery here that is running posteriorly. So it will be posterior to the brachial artery. So this profunda brachii artery, it is a branch of the brachial artery, but it comes and then it runs posteriorly to the brachial artery. So that will be a posterior relation. Then medially, we have the upper part of the ulnar nerve, and the basilic vein, and then the lower part of the median nerve. So let's identify the upper part of the ulnar nerve, and then the basilic vein, and the lower part of the median nerve. So here you find your ulnar nerve, but if you trace it upward, the upper part of that ulnar nerve is posterior to the brachial artery. Sorry, 1 minute. Yeah, this is it. And then the lower part of the median nerve. So let's look for the median nerve. Here we have the median nerve. The lower part of the median nerve runs posteriorly. So this is the median nerve, the lower part of it. If you look at this nerve, at this aponeurosis, it will run under or behind the brachial artery. So that is why it is, media, to run media, not posterior. It will run media to the, so this is it. It will run media, this median nerve, if you trace it down, it's running media to the brachial artery. Here, at this point, it was running lateral to the brachial artery. But once it crosses this artery here and comes to this side, it's running medial to the artery. So this is the medial side. So this ulnar median nerve, the lower part of the median nerve, is running medial to the brachial artery. Then the basilic vein we couldn't find in this diagram. It's not labeled in this diagram. So on the lateral side, you have a Coraco brachialis muscle, your biceps, and the median nerve in the upper part. So like we said just now, the upper part of the median nerve is lateral to the brachial artery. Now let's see it again. So this is the median nerve. The upper part of the median nerve is lateral to the brachial artery, but the lower part is medial to the brachial artery. Then where is our biceps muscle? So this is the biceps brachii muscle. So this is the biceps brachii muscle. You see that the bicep is running lateral to the brachial artery, running lateral to the brachial artery. So you could say the lateral relation of the brachial artery. You could mention the tendons of the biceps muscle. Okay. Now, anterior approach to the proximal humerus. So the proximal humerus, or the upper part of the humerus, you have your anterior circumflex humeral vessels. So the humerus, the upper part, you have your anterior circumflex humeral vessels anteriorly. Posterior approach to the humerus, you have the profunda brachii artery. The profunda brachii artery runs posterior to the brachial artery. And at the elbow joints, it curves laterally to lie over the anterior surface of the bone, where it may be damaged in supracondylar fracture of the humerus. So when that artery gets to the brachial artery, gets to the elbow, it curves laterally to lie above the anterior surface of the bone. So where it can be damaged. So if there's a fracture of the humerus, the artery can easily be damaged. If there's a fracture of the humerus around this elbow joint, the artery can easily be damaged. Okay, 1 minute. Now, if you ligate the brachial artery above the level of origin of the profunda brachii artery, it results in amputation in 50% of the cases. So what does that mean? Now, if we occlude the brachial artery, we maybe tie a tourniquet or something to block the brachial artery above the level of origin of the profunda brachii. Now, why above the level of origin of of the profunda brachii. So look at this is the profunda brachii here. Okay, this is the profunda brachii. Now this is brachial artery. If you ligate this artery here at this point, what will happen is that blood will no longer get down to this side, and blood will not even get to this profunda brachii. But if you ligate the artery here below the point of origin of the profunda brachii, if you ligate it here, there will be no amputation. There will be no need to amputate the hand. Why? Because this profunda brachii that comes here will still supply blood down, to the elbow joint and the muscles that are down. But if you ligate the artery above the origin of the profunda brachii, blood supply to the rest of the arm will cease. And when that happens, all this muscle, there'll be muscle wasting, and all the tissues around will suffer necrosis, and that might lead to amputation of the hand. Okay, so that is just a clinical concept that you need to know, that ligation of the artery, of the brachial artery above the level of origin of the profunda brachii results in amputation in 50% of cases. But if you ligate below, the risk of amputation would decrease. So whereas the risk of amputation is half if the artery is ligated below the level of the profunda brachii. So only in 25% of cases, there will be amputation. Why? Because I said that before this artery gives off the profunda brachii artery, once you block blood supply, it means that blood cannot come down this way and blood cannot enter the profunda brachii artery. So this whole arm would hardly get blood supply. But if you ligate below the profunda brachii origin, even though blood might not come straight through this other part of the brachial artery, the profunda brachii artery can still carry some volume of blood down to the other muscles, so that the risk of amputation will decrease, because the blood vessels or the muscles will still receive some amount of blood supply. So that's about the brachial artery. Quickly, brachial artery begins at the lower border of the teres major, and then it ends 1 cm distal to the elbow joint by dividing into the radial and the ulnar arteries. The branches are the profunda brachii artery, the nutrient artery of humerus, the superior ulnar collateral artery, inferior ulnar collateral artery, and the muscular branches. So that is all you need to know. Then again, you want to remember the relations, and know that the artery runs superficially. It runs superficially. So you want to remember the relations. Lateral to this artery, you have your biceps brachii muscle, and then you have the upper part of the median nerve. Okay, so these are the lateral relations. On the medial side, you have your ulnar nerve, you have your triceps muscles, and then you have the lower parts of the median nerve. So they are lateral relations of the artery. And then even then anteriorly, you have the aponeurosis of the biceps muscle, runs anterior to the brachial artery. And then of course, anterior relation also will be skin, superficial fascia, deep fascia, because all of them are supposed to cover this artery. So those will be the anterior relation. Then the posterior relation will be your Coraco brachialis, and majorly your triceps muscles that are behind. The bulk of the tricep muscle is posterior, right? And the triceps muscle, the Coraco brachialis muscle and the biceps are the main, and then the radial nerve also runs behind. So that will be the posterior relation. So basically, that is everything you need to know about the brachial artery. And remember that if you ligate the artery above the point of origin of the profunda brachii, it might lead to amputation in 50% of the case, because blood supply to the upper limb will be greatly reduced, and that will lead to cell destruction, tissue necrosis, and the only way is to amputate that limb, or the upper limb. Now, if you ligate it below the origin of the profunda brachii, it could lead to amputation only in 50% of cases. Okay, so we said that the brachial artery would terminate as radial artery and ulnar artery. So let's see if we can quickly look at the course of the radial artery. So the radial artery begins from the brachial artery near the neck of the radius and passes deep to the brachioradialis. So we said earlier that the brachial artery will divide 1 centimeter distal to the cubital fossa or the elbow joint before it will split into the radial and the ulnar. So the radial will begin near the neck of the radius. And then at the wrist, it passes in the anatomical snuff box. So there's a little snuff box around your wrist. The artery passes there, and it is around that place that we take the pulse, the radial pulse. So know that there is an anatomical snuff box, in your around your wrist. So the artery, radial artery, passes through that anatomical snuff box. And then it ends in the hand by anastomosis with a deep branch of the ulnar artery. So the ulnar artery has a deep branch, which will anastomose with the terminal branch of the radial artery. And then they form what is called the deep palmar arch, which we will look at later. Now, what are the branches of the radial artery? So we'll have the radial recurrent artery, the palmar carpal branch around the wrist joint, the superficial palmar branch, and then muscular branches. Radial recurrent artery, palmar carpal branch, superficial palmar branch, and the muscular branches. So let's try to identify the radial artery. So this is the radial artery here. This is the radial artery. So it's running on the side of the radius. So you have your ulnar bone here and your radial bone on this side. So you see the radial artery running on the radial side and then comes down here at the level of the wrist. It will pass through the what we call the anatomical snuff box, which you cannot see in this diagram. And then it will terminate by forming the deep palmar arch. So the deep palmar arch. Here you see deep palmar branch of ulnar artery. So that deep palmar branch will join a deep branch from the radial artery and form the deep palmar arch around the elbow joints. Let's see if we can see a better diagram. So good. So the radial artery here gives up the palmar carpal branch. So the palmar carpal branch, which will supply the carpal bones that are here. So here again, you see the palmar carpal arterial arch. So formed by the palmar carpal branch of the radial artery and the palmar carpal branch of the ulnar artery come together to supply the carpal bones that are here. Then you have the superficial palmar branch of the radial artery, this one, superficial palmar branch of the radial artery. And then you have the superficial palmar branch of the ulnar artery. So both joining also to form the superficial palmar arch that are here. Okay, let's see. Here the muscular branches are not labeled, so you can only see the palmar carpal branch and the superficial palmar branch. Let's see if we can find the radial recurrent artery. It's not labeled here, but it should be going back upward. So you see a branch that is going upward, but it is not visible in this diagram, radial recurrence artery. Okay. So here you see this is the radial artery. This is the radial artery here. This is just showing you the wrist joints from the posterior side, the wrist joint from the posterior side, and showing you the relations of the radial artery on the posterior side. Okay, surface anatomy of the wrist region. So the course of the radial artery. Anteriorly, the upper part, brachioradialis, the upper part of brachioradialis, the lower half is the skin, and then superficial and deep facial. So you see that the upper part of the radial artery anteriorly is covered by the brachioradialis, and the lower half is covered by skin, and then superficial and deep facial. So these are the anterior relation of the radial artery. Skin, superficial, and deep facial, and then the upper part of the brachioradialis muscle. Posteriorly, it is covered by what we call the bed of the radial artery, where the muscles upon which the radial artery is lying. Then medially, you have the upper 1/3 is the Pronator Teres muscle. Lower aspect to third tendon of the flexor carpi radialis. So Pronator Teres, let's see if they are labeled here. So, okay, it is cut already. So this is Pronator Teres muscle. And let's see if we have a better diagram. Okay. So the Pronator Teres muscle has a humeral head. So this muscle also forms the relation of the medial relation of the radial artery on the upper part of the radial artery. So this is the radial artery, but this Pronator Teres muscle covers this whole place. So it is medial to the radial artery, but the Pronator Teres has an ulnar head and a humera head. So the ulnar head is closer to the radial artery, so it forms a medial relation to the radial artery. Maybe 1 minute. And then laterally, you have your brachioradialis muscle in the whole extent and the radial nerve in the middle 1/3. So on the lateral aspects of the artery, you will find the brachioradialis and the radial nerve. So this is brachioradialis muscle coming down here. So running lateral to the artery, and then the radial nerve also running alongside. So these are the lateral relations of the artery, of the radial artery. Okay. Now the next thing we need to look at, let's see how it ends. So the artery ends in the anatomical snuff box to reach the proximal end of the first interosseous space. So it ends in the anatomical snuff box. And then two heads of the first dorsal interosseous muscle, and between the two heads of the adductor pollicis to form the deep palmar arch. So the artery actually ends by forming part of the deep palmar arch. But it doesn't just end, it's anastomosed with branches from the ulnar artery to form the deep palmar arch. Okay. Anterolateral approach to the elbow, you have the recurrent branches of the radial artery. Anterior approach to the cubital fossa, you have the radial artery. Anterior approach to the radius, or what we call the Henry approach, The radial artery runs down the middle of the forearm under the brachioradialis muscle. So these are the places where you can find the radial artery, where maybe you want to ligate the artery or do something with the artery, you can find the artery at this point. Anterolateral at the elbow joint, what you will see the recurrent branch of the radial artery. In the cubital fossa, you'll see the radial artery itself, and then around the radius, you see the radial artery also there. And then the dorsum of the hand, the artery will have will give off a branch, which is called the branch to the lateral right side of the dorsum of the thumb. And then we'll have the first dorsal metacarpal artery, And then in the palm, it will supply the Pollicis muscle. So we'll have the artery called the princeps pollicis artery and the radialis indicis artery, supplying the palm. So these are smaller end branches of the radial artery. So here you see the princeps pollicis artery here, princeps pollicis artery. Here you see the deep palmar arterial arch, which is formed here also, and the superficial palmar branch of the radial artery here also, supplying, forming part of the superficial palmar arch. So the same thing you get from the radial side, you also get from the ulnar side for the ulnar artery. So all of that supplies this, the palm of the hand. So let's see, radialis indicis artery. So this is the radialis indicis artery, supplying this index finger here, supplying the index finger. Okay, so I think we will do ulnar artery separately. Let's so we don't mix everything up, because there are a lot of names today, yeah. So we'll do the ulnar artery and do the anastomosis around the elbow joint and the wrist joint. We'll look at the palmar arch, superficial and deep palmar arches also. Okay, tomorrow we would answer some questions. I think we can do ulnar artery tomorrow and then answer some questions alongside.
Okay, sir.
Okay, thank you.
Thank you, sir.
Yeah, bye.
Yes.